for the influence of childcare on high antibiotics use in a multicultural, lower socioeconomic community. The floor is yours.
Merci, bonjour tout le monde. Good morning. Very nice to be with you all from Sydney, Australia. So a long way away. Great to be here. So our topic is high antibiotic prescription in children under 9 and the relationship with daycare. I'm not sure what it's called here, nursery care of children before they go to school. And I want to acknowledge my authors, including Qummouh Michael Tam, who is here in the audience with us this morning. So antibiotic use in Australia is high. We are a high prescribing nation. And the area that I work in is a lower socioeconomic area, very culturally diverse, and antibiotic prescription rates are higher in those areas. And there's a national atlas of healthcare variation in Australia which describes the variation in healthcare right across the country, and found that our region was the second highest region in a high prescribing country for prescription of antibiotics to children under 9. I'm part of a local healthcare alliance between various aspects of the healthcare provision and the local council. And we were sitting around a table discussing, why is it that our region is so high in the prescription of antibiotics? And the idea bubbled up really from local people saying, we think it could be related to daycare, to childcare before school, and pressure from the childcare on the parents to get antibiotics so that the children can go back to daycare and not be excluded. There's actually few international studies on this topic. There are a couple, but the interesting thing is that when I mention this to parents and to GPs, there's often a smile of recognition. And I don't know if that's the case with you, but it seems to be all around the world that there's at least this rumour or idea that it's an influence. So we sought to explore this idea in our local region, to investigate the knowledge, attitudes and behaviours of parents and childcare workers regarding antibiotic use. So we employed a qualitative methodology, purposive sampling of parents and daycare workers in our region. We were really pleased to be able to include English speakers, but also participants who did not use English as their first language. So we used Vietnamese, Arabic and Assyrian, the major populations in our region. Up to 2/3 of households in our region do not speak a language other than English at home, and about 60% of people in our region actually were born overseas, so it's a very diverse region. We interviewed 18 staff members and 20 parents from 7 childcare services across the region. And then we used semi-structured telephone interviews and thematically analysed them with qualitative methodology after Braun and Clark. And we were really pleased to get that many people because it was the middle of COVID. And the daycare centres were like fortresses. No one could go in or out, including often the parents or the kids. And recruiting people was extremely difficult. But we had a great research worker who did it. What did we find? 2 broad analytic themes. One we described as antibiotic culture. That is the views and attitudes and behaviours of the local people about antibiotics. And the other related to the regulatory environment. That is the sorts of rules and regulations around how you can bring your child to daycare or whether you can't, and also the pressure with regard to work and sick pay, being paid when you weren't at work. What did we find with the antibiotic culture? Well, there was knowledge of the public health messages. People knew that the antibiotics, or had heard that antibiotics should not be given for simple infections. However, once we dug below that belief, there were many exclusions to this. If there was a green nasal discharge, if there was a persistent cough, a sore ear, or persisting symptoms, then they required antibiotics. In the regulatory environment, there was a high pressure to work, and there was rules about getting your child into daycare, including a certificate from the doctor was very helpful. Interestingly, most people did not know there was a high prescribing area, and so perhaps it had been normalised, but we did not find any explicit pressure on parents to get antibiotics. No one said, go and get antibiotics. This is the comment of one of the parents. I won't read it out, but basically it describes the difficulty of work, the pressure to get kids to daycare, and their concerns for the child's health, and also that they won't be able to get antibiotics when they need them. So In general, we didn't find explicit pressure, but the way the sort of discussion went was, I need to work, I won't get paid if my child is at home because I'm looking after them. I know they don't need antibiotics, but I think it will shorten the disease. So, and also if I get a certificate from the doctor, I'll get them in to daycare. But when they go to the doctor, of course, we know that greatly increases the chance of getting a prescription. And also, they said that doctors that they were seeing tended to come from countries where antibiotic use was high. Often you could get antibiotics over the counter, and the epidemiology of that country meant there were many infectious diseases, so they often used antibiotics. So they were more likely to prescribe. In summary, high antibiotic use is multifactorial. It's not all due to daycare, but there are a lot of cultural beliefs, parental work pressures, and administrative routines of childcare which drive use. Addressing the problem requires culturally targeted public health messaging regarding antimicrobial resistance and perhaps the harms of antibiotics, which the parents did not tend to list. Future directions, we did not speak to the GPs, but we think the GPs are obviously a key player here, both in terms of education and also in terms of their own behaviours. So we think speaking to the GPs in future research may be important. Thank you for listening. If you'd like to read more, it's published in BMC Public Health, and that's the work.
Congrats. And we have 2 minutes discussions. Yeah. Any question? Yeah.
I'm a GP from the Netherlands, and I was wondering, in Australia, the antibiotics aren't over the counter on prescription.
Not over the counter.
And do you have any insights on which kind of antibiotics are prescribed, mostly like amoxicillin or something like that?
Broad spectrum antibiotics like amoxicillin.
Okay, thank you.
Over the counter, on peut prendre sans ordonnance à la pharmacie. Donc non, ce n'est pas le cas. Any other question? Could you maybe just tell us more about daycare? Is there tiny groups of kids, like one person with 3 kids, or is it bigger groups? What kind of daycare it is for these risks of contamination?
Most commonly large groups, a bit like a school. You take your child and you drop them off, they stay there for part of the day or all day. There is also another method where some families provide daycare to a small number of children. So we sample, and there's big corporate daycare providers, and then there are more boutique or small providers, and we sample all types.
Yes.
Thank you very much.
Congratulations.